It's a lie told by the Democrats that they're not trying to give health care benefits to illegal aliens. It's a lie that is obviously untrue if you just look at the text that they gave us. And all you have to do is understand that this is about who benefits. We think the American people's government ought to benefit American citizens. The Democrats are willing to shut it down to benefit illegal aliens. The contrast couldn't be more clear.
Day 3 of the government shutdown, and what is the big issue preventing it from reopening? Well, it's health care, specifically for immigrants who are in the country illegally.
Now you heard Vice President Vance there expressing what many Republicans have since Wednesday morning, that the Democrats want to extend benefits to undocumented immigrants, an idea that Democrats have pushed back hard on. Take a listen to Senator Elizabeth Warren on CBS Mornings Thursday.
Republicans say what you're really fighting for is taxpayer dollars for, as they put it, illegal aliens. I know that's not strictly true, but there is a provision.
Excuse me, not strictly true.
It's not true directly, but
out lie.
Senator Warren continued, insisting that the money Democrats are fighting for will go to hospitals and not undocumented immigrants.
The difference is whether or not hospitals, who under laws that date back to Ronald Reagan, may provide emergency care to anyone who's unconscious, will actually get reimbursed at a very low level that will put the hospital ultimately out of business potentially, or at a higher level. The Republicans, there is no change in the number of undocumented immigrants who get any help under what the Democrats want.
But it's not just emergency room funds that are at the heart of this debate. Vice President Vance also pointed out a second part of the Democrats' proposed plan that he says gave certain immigrants a special status to collect health care benefits.
The Biden administration gave mass parole to millions upon millions of illegal aliens, and then they simultaneously made those parolees eligible for health care benefits funded by taxpayers. In the One Big Beautiful Bill, President Trump and congressional Republicans turned off that money to health care funding for illegal aliens. The Democrats want to turn it back on. And in their initial proposal, the first thing that they put out to reopen the government, they actually turned that money for health care benefits for illegal aliens back.
And even some Democrats are admitting that at least some money would go to health care for illegal immigrants. Here's Ro Khanna saying exactly that.
The amount of money that actually is going towards people who are undocumented is such a small portion of the Medicaid cuts or the Affordable Care Act, if at all. And so we can argue that point, but the reality that even the vice president would acknowledge, that anyone who looks at the numbers will acknowledge, is 90 to 95% of the funding we're talking about is talking about funding for American citizens.
Now, as the debate continues, there's still no deal in sight. Members of Congress tell The Hill they expect the shutdown to drag on until at least the middle of next week. Some expect even longer. I mean, I think shutting down the government, I've been saying this over and again since the first time we talked about this year, is a failure of Congress to do its job. So I think where a lot of Democrats and Republicans agree is that this is not ideal. I think this has been labeled one of the most ineffective Congress in years, in history, even. And so to me, it's just frustrating to watch this all play out. I know it happens on both sides. You can look at the last decade and see who was responsible for which shutdown. But for me, I think Republicans are just misleading and not being honest. And I really wanted to articulate what the law actually does and what is actually being discussed. So I think there's already U.S. law on the books that prohibits migrants from getting federal subsidized health care. That's understood, right? Through Medicaid, Affordable Care Act, Children's Health Insurance Program, there's a 1996 statute that established that. So the Democratic bill doesn't change that existing law. This dispute, it really revolves around these words called lawfully present, and depending on how they're interpreted. So there are estimated 1.4 million people that are considered, quote, lawfully present within the United States, including DACA people, which is Deferred Action for Childhood Arrival, and people with TPS, which is Temporary Protected Status. And so those beneficiaries who are still going through the legal process, maybe some people that actually are affected here, but we're not talking about random people who just jumped over the border. And they're not technically undocumented or illegal immigrants. The government knows exactly who they are. You know, many are going through the process of seeking that legal documentation. And among other things, you know, they're not unlawful border crossers. So I think that when we're conflating every single thing around immigrants, it's frustrating because we're having conversations about people who are here by laws that we put in place, like temporary protected status or DACA, and we're saying, okay, well, now we want to make sure that none of these people are getting care. Or like Elizabeth Warren brought up, if emergency room visits, like what are we going to do if somebody goes to the ER? They're going to get help because they're wheeled in. It's not happening at a going rampant rate of migrants in the ER. But if they are, what's the plan here? We have to come up with a plan because they are here. And sometimes, even though people wanted immigration reform, the president's goals with getting every single person out is extremely lofty. And if somebody goes to the hospital, what's our plan?
Yeah, so you're correct on that point that does exist, that program that you're talking about for reimbursement for medical care. But in addition, there's also this reimbursement for the emergency room services, which does go to illegal immigrants. And also if
to the hospitals, right?
Right, for care for illegal immigrants, and I'm going to talk about that because there's a lot of fraud wrapped up in that issue. And then in addition to that, there are some state programs, which are not federal, so it's not against the statute that you're talking about, that do provide additional Medicaid funds for illegal aliens outside of emergency room care, and they get federal reimbursements for the money that they spend on those individuals. So one of the contentions from Republicans was, we don't want to indirectly subsidize states' Medicaid programs for giving care to illegal aliens. They should have to bear the brunt of that cost because it's their policies, which are against our policies, that allowed illegal aliens to come in and place that burden on the healthcare system. But I want to get into this point about emergency rooms because Chris Pope from the Manhattan Institute put out an interesting tweet thread about this issue, which showed that it's not really just people who are unconscious going to the emergency room and getting care, that these hospitals are being used as primary care providers for illegal aliens because they know that they're not going to have to pay for the services. He pointed out that Medicaid spending on emergency services for undocumented aliens soared last year. 71% of the spending is in California, where spending on emergency services for illegal aliens jumped from $1.6 billion in 2023 to $6.4 billion in 2024. They established a state benefit for undocumented immigrants, supposedly with state money. They have classified 56% of its increased spending on unauthorized immigrants as emergency care. Well, normally emergency care only accounts for 5% of healthcare spending. So this is a classic case of Democrats saying, well, it's only when people are going to the hospital because they're going to die otherwise, when really what they're doing is they want the federal government to reimburse the hospitals, and they're going to give all of their primary care, all medicine, to illegal aliens through the hospitals so that they don't have to pay for it themselves.
So while I don't think attaching this issue is necessarily the right thing to do right now for Democrats, I do think that Republicans are going to have to come to the table and talk about this. And I don't know why Democrats who are not in power or a powerful position would wait till the next opportunity towards the end of the year when we pretty much know how this game goes. And I know that Republicans have to be concerned because there are News Nation reporters that are reporting on Congress on the ground saying probably there are some conversations happening between, not a lot, but some Republicans about how to come to the table on this, in this shutdown. So it's not like Democrats are just catching the L here only. I think people have to be considerate that there are people like Senator Josh Hawley, who is very vocal about how cuts to Medicare and Medicaid will affect his constituents, and I think that he's not the only person that feels that from the big, beautiful bill. And so going again and saying healthcare, we can deal with it later, no matter putting the migrants aside, there's still people who are concerned about their healthcare. And so this conversation does need to happen really soon. And I think that Democrats are pretty confident that Republicans are probably not going to engage them before these subsidies from the Affordable Care Act run out at the end of this year.
Well, I know we're going to continue talking about this issue, but up next, a judge has struck down Kilmar Abrego Garcia's bid for asylum. We'll discuss what it means for his deportation.